Targeted therapies are not a free lunch. They unfortunately do have a number of side effects that are real and can affect patients' quality of life. Probably the most common is a skin reaction. They have a decently high rate of causing rashes. There are some that can affect mood or cognition, some that can affect your sleep. Many of them do upset the gastrointestinal tract, so that can manifest as either constipation or diarrhea or just frequent bowel movements. It can cause fatigue, having lower energy, and some can affect your blood pressure, so causing a higher blood pressure, or really other cardiac issues like low heart rate, those types of things. So those are all things to consider when we're thinking about the different targeted therapies, and also things that we monitor when we're talking to you about what you're experiencing on a targeted therapy. But there are some actually really unique advantages of targeted therapy that are special to this class of drug. One is, I mentioned, most of them are actually oral medications. Most of them are pills that you take at home. And actually, they're pretty well tolerated, especially as we get later into the development of these targeted therapies. We're able to target with more specificity, and we're not targeting, we're not having more off target toxicity, which basically means we're not hitting the things that we don't want to hit, the normal cells. And one of the real benefits, especially of the small molecules, in particular the pills that are targeted, is that they're so small that they can sneak their way into the brain and sometimes affect disease that's in the brain. So that's something that we really look for and is a huge advantage of targeted therapies. We're going to hear next about resistance pathways, but targeted therapies can also be used to target resistance pathways if we can figure out why a patient has become resistant to a certain target, to a certain therapy.